We've watched a few Dhar Mann episodes before. Oh my God, no! But my team has informed me that somehow it's gotten worse.
Took you long enough.
Oh, sorry, I had to finish up a couple things.
Oh, does she have different eye colors?
Here's your tea. I hope you like it.
Whew, that's terrible. I knew something smelled off. Where is your honey?
Well, we don't keep any in the house. I'm highly allergic.
Usually honey allergy is caused by the proteins within the glandular secretions from the bees themselves, or perhaps the proteins from the pollen.
Would you mind grabbing the honey substitute? It's just right over there.
Is she gonna try and poison her daughter?
Jenna does deserve the first slice, though. Go ahead.
First dibs.
Oh, okay.
Does she have a true severe honey allergy? Is she about to go into anaphylactic shock? If she has a true anaphylaxis to honey, then she probably has an EpiPen. And if she has an EpiPen, we could just inject it, go to the ER, and she'll be okay.
You did use the honey substitute, right?
Well, of course. Go on.
God, this is evil. Uh-oh.
Honey, are you all right?
I feel like I can't.
Remember, part of the mechanism by which anaphylaxis happens is hypotension, vomiting, not just the swelling that's present in the airway.
I can't breathe.
Why is everyone just watching and no one's calling for help or grabbing an EpiPen?
We gotta take her to the hospital right now. Here, help her.
I would actually call 911 instead of taking her to the hospital. It'll be faster. They'll arrive with an EpiPen and they'll be able to get her airway stabilized.
Stay with us, stay with us.
This is the worst hospital ever. They're putting her on a wheelchair instead of giving her the treatment right there in the triage.
Jenna, stay with us.
What do you mean stay with us? She has no airway. The ABCs, airway, breathing, circulation.
She's crashing.
You're
No,
crashing
no.
this hospital.
Please, please.
I didn't
Please
know
help
her
her.
allergy was this bad.
What is the usefulness of putting the oxygen when she can't breathe? Where are they injecting it? Into the hand?
You okay, honey?
Arm?
Hang on.
Give it into the anterior lateral thigh.
She's not responding to the injection. That's not.
You gave it to her 2 seconds ago.
She's gone into anaphylactic shock. This is dangerous.
No shit, Sherlock.
How is this possible? She didn't have anything that she was allergic to.
Yes, she did, my guy. Clearly she did.
This doesn't make any sense.
If the doctor uses the pen light one more time on an unresponsive closed airway patient, I'm gonna throw my phone at this.
You sure she didn't?
Because it's going to determine the treatment we use.
Yes, I'm sure.
Open her airway, see that it's swollen shut, inject the epinephrine. If it doesn't work, create an airway, insert an airway, do something.
I lied. I'm so sorry. I lied.
Yeah, let's have this dramatic situation play out while the poor patient is literally dying on the table.
I did put honey on the ham. I am so.
And she keeps checking for a pulse. She has no airway!
I just thought.
And she's slapping her now.
Can you believe this, Jenna?
I can.
No! No! No!
What is happening?
They knew she knew. This is...
I hoped you wouldn't actually go through with it. And I even gave you a chance to tell the truth. But when you kept going,
Just threw it on the ground.
I faked like I ate it instead.
This makes me feel less bad about the doctor slapping her while she was dying.
We're pregnant.
How? Dhar Mann is trying to kill me by making this content.
She looks like a hobo off the street. It's disgusting.
What doctors talk like that? Hippocratic oath. We treat everyone. And she looks well-dressed, well-kept. What are we judging here?
Just by looking at you, I doubt you've saved enough.
First of all, doctors don't even know how much things cost. We leave that to the administrators. We practice medicine.
I require a down payment, $25,000.
I wonder what this procedure is that it's so expensive. Is she looking to change her eye color or something? Because people are doing that these days, and I don't recommend that.
And then the final bill will run over 4 times that. I can't help you.
I will say the premise of all this is quite accurate in that people face bankruptcy because of their medical bills. And a lot of times it's not even their fault. They went to an out-of-network hospital for an in-network provider, and you could be facing bills in the 6, sometimes rare instances, 7 figures.
Maybe if I sell my jewelry, we would probably get enough for the down payment.
No, Jess, you can't. Your mother passed those down to you.
I give you $40,000 for the whole box.
You have yourself
That's a lot of jewelry that got passed down.
the deal.
All right, there you go. Let me get you your money.
You're not getting that. Stop it.
Help! Someone help! Who robs from a charity?
Yeah, that's really messed up, especially the Boys and Girls Club. In fact, here's the time we donated to the Boys and Girls Club after I got my butt kicked on Showtime pay-per-view boxing.
What were you raising money for?
The Boys and Girls Club on 4th Street? Unless we raise $50,000 by next week, the local chapter is gonna have to close.
How much money could they have raised on just the sidewalk?
Maybe this will help you get back on track.
That's so kind. I still want to know what medical condition she has.
Yeah.
They didn't even give her a tax-deductible receipt that she could use to write that off on her taxes.
Mom, are you okay? I heard what happened.
I'm fine.
The doctor just runs around in his white coat.
And I'm thankful because that nice woman, she made this huge donation.
Dr. Fisher, what are you doing here?
Sorry to intrude. I've been trying to find you for the past few days. I got your address from Dr. Watts. I hope you don't mind.
Why don't you have her address if she's your patient?
I was rude and disrespectful the other day.
That's a good direct apology. I like to see that.
And after my mother told me how generous you were to her.
Your mother? She's...
And I love that there's now a rash breaking out, some periorbital redness and swelling.
Yes, I am. And I raised my boy to be better than the way he treated you.
I would hope so. You raised your boy to look at patients in the waiting room who are struggling and saying, look at that hobo.
I've decided I'm going to start doing pro bono surgeries for patients that need it in our community. And I would love for you to be my first patient.
Wait. Are you telling us that you mean you're going to do it, the surgery for free?
A lot of hospitals have these types of pro bono coverages. In some areas, they're called charity care programs, especially for non-for-profit hospitals. The government does offer them some tax incentives.
What is wrong with you?
That's assault. You just pushed your employee. And why didn't she dab when she sneezed?
Sorry, Mr. Billy.
Thanks.
I see potentially maybe allergic situation, upper respiratory infection.
Sorry doesn't get your nasty germs off my jacket. What is with you today? Are you trying to be a national disaster?
A national disaster? She's sick.
Hey, get off me.
Don't...
Get off me. She faints. Don't you trust fall on me.
Can't you see she's sick?
Oh, no, she's not. She's just trying to get out of work.
What people don't understand when they force their employees to come in sick is that ultimately you will lose productivity because this is an infection. It's a communicable disease, which means that the pathogens are going to communicate across all your employees, and therefore everyone will ultimately get sick, including you.
Sasha, would you please show Mr. McKenzie to the conference room?
Absolutely.
I hope she doesn't kill Mr. McKenzie here. If she has the flu, it could be deadly for someone in his age group.
The balance you found between profit and giving back to the community is something we all should aspire to.
Well, thank you. Thank you. We built quite the little empire, actually.
Oh, syncopizing. That situation just went from bad to worse because she was sick, obviously, and spreading it. But now she hit the back of her head, which can lead to a brain bleed, a counter-coup injury where the brain, because it sits in a soup, hits the back and the front of the head.
Mr. Billings, what happened?
You fainted and were unconscious.
And she has bruising under her eyes.
Ambulance, I can't afford...
Don't worry about that now, okay? When you were unconscious, I overheard the doctor saying you had recently been diagnosed with some rare form of lupus.
A rare form of lupus, SLE, lupus, autoimmune condition, can cause joint pains, the very common malar rash, also known as a butterfly rash, creates inflammation within the body.
Why didn't you say anything?
I thought about it, but I didn't want to bother anyone with my problems. The truth is I can't afford treatment. And that's why my body is failing. All my energy is just gone. And that's also why I've been chasing the promotion so hard. With executive level benefits, I could afford treatment and get back to the old me.
Executive level benefits.
Glad you told me this now.
Me too.
Want to know a secret? I was never really planning on promoting you. It was just a motivational tool. And now,
Why would you say this in the hospital?
knowing this, there's no way I'd ever promote you.
Wait, why?
Do you know how much our premiums will go up if I have to carry you on our insurance policy? Forget about it. It's bad business. It's better to just fire you now and save some money.
What kind of monster are you? Firing a woman when she's in a hospital bed.
Oh, not just her. You're fired too.
Is he gonna develop lupus as well?
Are we ready to sign this deal or what's going on? Why are they here? Didn't I fire you too?
You did. And then I hired them. You see, I was concerned about your employee who passed out.
Yeah, the billionaire decided to come pay a visit in the fake hospital.
So I dropped by the hospital to check on her. I was horrified to hear how you treat your people. So after you walked out, I walked in. And the three of us got to talking about the best ways to get even.
Why does everyone want to get even? Just, why didn't he walk in when he heard him yelling and confront him right there and then?
I informed Mr. McKenzie just how close to insolvency this company really is.
So instead of giving you $20 million to prop up your failed business, I decided to buy it and turn it around myself.
You can't do that.
It's already done.
Good afternoon, Mrs. Gladstone. I'm Dr. Henry.
Oh, there must be some mistake. I'm here to see Dr. Jalen Henry. He's supposed to be the best surgeon in the state.
No mistake, you are in the right place.
Excuse me?
I mean, I don't mean to brag, but everything that you've heard about my abilities is correct.
Can you imagine if one of my patients came in and I said, everything you've heard about my abilities is correct. I am the most famous. I am the most sexiest doctor alive.
How can someone like you be a doctor? What is that? Some sort of gang tattoo?
Look, people are judgmental assholes, and they do exist, but I've never seen it be this ridiculous.
I can't do this, not with you. Anyone who gets a tattoo on their neck is someone with very poor judgment.
Says the person with very poor judgment.
I want to cancel my procedure.
Nice to meet you, Dr. Miller.
And you're here for a brain tumor removal, correct?
That's right.
Oh my God.
I almost had the procedure done by this thug, Dr. Jalen Henry.
Are they gonna act like this is his first procedure ever?
Doug.
Yeah.
Dr. Henry's an excellent surgeon. I mean, he's every bit as good as they say he is.
How many of these procedures have you performed?
That's a very important question to ask your doctor before undergoing any procedure. And by law, they have to answer you honestly.
It's my second time. First since I was an intern.
Oh my God.
Typically, most patients see Dr. Henry if they can.
I owe you an apology. The way I
Please
treated
operate on
you
my
was
head.
just
Oh, I like his Apple Watch.
completely out of line.
Well, I appreciate that, Miss Gladstone. One of my favorite things to do was draw with my daughter. But something was wrong. She was diagnosed with a brain tumor.
Even I couldn't fix.
Despite all my years of studying medicine, it was too late and I couldn't do anything to save my daughter.
I wonder if it was a GBM, a glioblastoma multiforme.
She said she loved how happy her drawings always made me. So I promised her
I'd put it on my neck. It's a weird place to commemorate your daughter too.
I'd get one of them tattooed on my body so I'd always be able to see it. And
the neck is not really a place you'd always be able to see it.
And she picked the spot.
I'm so sorry for how I treated you. I should have known better than to judge a book by its cover.
Valuable moral, also valuable that the doctor felt comfortable crying in front of the patient, which too many times doctors feel like they need to put on a robotic, hyper-professional face when discussing intimate things with a patient in terms of, emotional things with the patients, probably a better way to put it. My residents included, and I tell them that if they feel an emotion, especially one that's positive, meaning that they feel sympathy or empathy, crying could be a totally appropriate thing. This is pretty cringe, but the Hallmark movies during the holidays are cringe too. Click here to check that out, and as always, stay happy and healthy.